Hi, welcome back to this series on cancer pain. In this video, I'm going to be looking more closely at the causes of cancer pain and particularly the mechanisms that underlie cancer pain as we understand at this time. Now, broadly, before starting, there are some common principles of pain itself that we understand, which are very important to bring into this conversation. Firstly, the distinction between what is nociception and pain. This is very important to understand because nociception is the term that we use when chemicals are released at the site of injury or infection or surgery, or where the tumor is invading into the structures and releasing inflammatory chemicals. That process of the release of chemicals at the site where the tumor is growing or invading or a surgery is being done, that is called nociception. By itself, that is not the responsible factor for all of the pain. When this chemical then travels to the brain through the nervous system and the spinal cord, the brain has to integrate these responses, look at what it has predicted as to where this response and the signal is coming from, and if it decides to bring about protection, that's when it will bring about the experience of pain as you understand it, and it can then amplify it or dampen it depending on how much protection it wants to give. So that clear distinction between nociception and pain is very important when you want to understand cancer pain before you can get to treating it. It also raises the relevance that you can actually treat these two components differently, because nociception is likely to respond more often to the standard mainstream traditional techniques like various drugs and possibly interventions. But that experience of pain is something that will require a different set of strategies, because that involves a sensitization of the entire nervous system from the area where the signals have been, the nociception, through the spinal cord to the brain, and that is something which requires, as I said, a separate set of strategies, and drugs really don't work. So that's the first part of the mechanism or the biology between nociception and pain. Second, we come to, well, what are the kinds of pain that people with cancer will likely experience? Often we find that, as I explained, one, in cancer pain, you can have injury, or you can have invasion of the tumor, or you can have a surgery related pain as well. Now, in all of these three, when there is an acute inflammation happening, that means the kind of pain is called nociceptive pain, because there are chemicals being released at the site of the invasion or the surgery, and that will be the nociceptive pain. The second would be where the tumor is sort of invaded and probably trapping a nerve or pinching a nerve, or as part of the surgery, you've actually caused a damage or cut the nerve, or it has to be sacrificed because you've had to remove a piece of the body there where a nerve is been as well. Or it could be because of the treatment. For example, some chemotherapy drugs, some immunotherapy drugs will actually cause a damage to the nervous system. In that situation where there is a noted and understood damage to the nervous system, it's called neuropathic pain because there is a change in there. Now, there is a third category called nociplastic pain. Nociplastic pain is when there is no obvious source of inflammation. So many breast cancer patients, many other forms of cancer patients, they would have had their treatments. There would be no evidence of infection or inflammation at the site where the surgery has been done even. There may have been some nerve damage, but there is no obvious nerve damage anymore happening. However, the pain intensity can be extensive, can be amplified, there can be variation in the pain. Some days it would be less, some days it would be more. This kind of fluctuating change reflects a kind of plasticity or enhancement or sensitization of the nervous system in itself. It can also be impacted by various other things. It can be by stress, by dietary factors, by sleep, by activity or sedentary or not moving. When you have a pain that is varying on all these factors there, that's called nociplastic pain. So cancer pain can be one of these three varieties. It can be nociceptive, it can be neuropathic, or it can be nociplastic. And often in many patients with cancer, I have actually seen a mix of this. So there is this component of what's called mixed pain, where you can have combinations of all three, or usually a combination of neuropathic and nociplastic. So it's very important to understand these three categories and types of pain, because the treatments for it will be different, and sometimes you have to bring in a mixture, a sort of assortment of treatments, wherein you have to combine a treatment for the nociceptive pain, which could be very well the drugs or maybe an injection, and you may have to combine a treatment for the neuropathic pain. Often we are finding that for nociplastic pain, you're looking at many integrative approaches. You're looking at many what we call mind-body techniques to be thought of and implemented alongside your drugs or interventions or surgeries that you are having for your cancer pain. It's very important to combine all this, and indeed when it comes to even cancer treatment and specifically cancer pain, integrative approaches are the way forward to give a more holistic, to give a more, sometimes a drug-free approach to calming your pain and your nervous system down. And I'll cover this in the next video. So thank you so much for listening to me, and I'll see you soon. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.